All right, I'm Ginille. I'm a cosmetic nurse practitioner here to answer all of your questions on skin, hair health, cosmetic injections. Let's go through it. I've been injecting Botox filler since 2013, doing all the skin treatments, things that are safe for black and brown skin. I have 3 medical spas. 2 are in Los Angeles. 1 is in Las Vegas. I am right now on a break, and so going to go through your questions. We can talk through anything. If you have them, pop them in there. Also, people will jump on and we will do our consults live here if you want. We do in our office virtual consults for almost everyone before they come in to go through your questions, goals, tips on what to expect, how to prep for treatments. In our office, we really focus on getting you safe, natural looking results, treatments. Everything we do in here is going to be safe for all skin types, all skin tones. You're going to look like you're going to look fresh. We are focusing not just on Botox and filler, which I love, but on skin health, hair health, body and wellness. So pop in, let me know questions. If you don't have any questions, I can also talk through some patient before and afters. I'm in the office now. Here's just a few of our patients. I like to show them here. I like to talk about what we've done. So these are some people that I just have on the wall so people can see what the results look like. I can talk through them. Like for this patient here, she came in concerned with under eye hollowness, felt like she looked tired. We did a little filler into the under eyes to help camouflage this fat pad. You can see her after. We do under eyes in 2 sessions. So we do some, we let it settle. We have you come back 6 to 8 weeks later, we reassess, and we can always do more if needed, but this is her after. And she just looks fresh. She doesn't have like the bags, so she doesn't look so tired, and that's the goal. When we do under eye filler, I tell people it lasts 1.5 to 2 years. Most people get longer out of it, so that is really nice. Also, again, if you have questions or if you want to jump on, we can go through consults. A lot of people will do their consults on live here. Here's some lip filler. I just want to show that lips don't have to be overdone. Here's her before, here's her after. We did this over a couple sessions. So we did a half syringe. I had her wait 6 to 8 weeks, came back and she did another half. You can see we want to maintain her shape. She has some hydration. We don't want it puffy above the border. I know you guys have seen lips that puffy up here. We're not trying to do that. We don't want things blown out. We don't want lumpy bumpy. So go slow, don't rush. Yes. All right, here is a patient that came in and we just did some to enhance her side profile. So from this photo here, you can see her chin sits back a little bit and you can't really appreciate it from this view, but we also did some filler into her cheek to give this lateral highlight on her cheek. It's going to help the cheeks to look lifted, look pulled up. Oh, hi guys, thanks for joining. If you have questions, go ahead, jump in, pop them in, or we can always do consult virtually if you want to pop in the box there. And so immediately after, a little bit swollen, but what we're trying to do here and what we accomplish is bringing forward her jawline. So you can see the after, the jawline is brought forward, helps to balance her lower face features to her upper face. So instead of the jaw sitting back, it's elongated, looks beautiful. You wouldn't know if you just saw this girl walking on the street, you wouldn't think that she's had Botox and filler. That's always the point when we're doing things. We want it to look like you, fresh, never overdone. Beautiful patient here. Love her. She was one of my coaches when I was at Orange Theory. Okay, so she and I ended up treating her entire face. We did multiple areas of her face, and majority of our patients that are doing cosmetic treatments, we're doing multiple areas of their face. We're not really here just like spot treating, only treating lips. That is pretty rare that we do that. Okay, let me make sure I'm not. Wait, how did you get that cheek lifted again? You just joined. So for her, what we did is filler into the lateral part of her cheek. Let me show you some more cheek fillers. Same, this girl also has a little bit of filler into her cheek. Sujia here has some filler into her cheek. This patient here has some filler into their cheek. And so it just kind of makes the highlight of, when I say highlight, I'm talking about the light here along the cheek to look pulled back and like upwards. Same, she had some filler into her cheeks to give a little fullness. And here's another one that had some filler into her cheeks, trying to give that lateral lift where we don't want it just in the center and the focus there. Okay, if you have questions, go ahead, you can keep popping them in. But for her, what we did was some filler to camouflage this fat pad. I'm gonna get a little pointer so you can see it a little bit better. We did a little bit of filler to camouflage this fat pad underneath her eye. So this little bag there, so we did filler there. And then laterally, as well as a small bit into her cheek. We did some filler into her lips. You can see before and after. And then what I think made the biggest impact on her, well, under eyes really did help as well, but was some filler into her chin to elongate the jawline. And so this is kind of showing you from a different angle. Here's a different person. Here's her side profile. So before, chin is set back. After, chin is elongated. Helps to harmonize the upper and lower face features. So same here. Chin is back. When we brought it forward, it helps to just showcase and highlight the lips a little bit better. When people just do lip filler and their chin is set back, it can look ducky. And that's where we were like, well, the balance looks off. Like, people don't know how to explain it, but it looks off to our eyes as people walk in the street. Okay, let me make sure I'm not missing anything. If you have questions, let me know. Studio City, Carmen, I would love to see you. We are in Mar Vista, we're in Torrance, and we're in Las Vegas. Someone said they have the same issues. Okay, let me know if you had. Do I do dissolving of previous filler? Yes, I'll dissolve your old filler if you don't like it, if there's any issues with it. You can also have your other provider do it, but we can do it in the office. So I think, yeah, she looks fresh. You can see her little tiny pokes because this is immediately after. Maybe it's going to swell. I tell patients 2 to 3 weeks, you could bruise, you could swell. She's not really bruised up. Like, she looks fresh. The next day she can put on makeup. She might have some swelling, but yeah. So this after is way more comprehensive and complete than if she just did her lips. If she only did her lips, guys, think about this. This would be full. This chin would be set back. You guys would know she did her lips. That's not the goal. We don't want it to look like you've done your lips. We don't want the lips to overpower the lower face. And then, underneath the eyes, it's just camouflaging that fat pad. So then people look brighter. They look rested. They don't feel like they look tired. They don't feel like they have the bag. Okay, let me make sure I didn't miss any comments. If you have questions, let me know. You can also jump in. I do virtual consults on live if you'd like. So yeah, similar thing to what we did in this patient here. So she is in her, I think she was in her late 20s, early 30s. She just turned 50, beautiful, love her. She came in just talking to me about lips and Botox, and we did lips and Botox at first. And lips and Botox, yeah, that's really cute. I think a lot of people think it's all just about lips. But I'm it's not always just about lips, guys. We don't want the lips to be forward and then the chin to be back. That's how the lips overpower the face. They dominate the face. And it looks ducky. So I did her lips once, and she came again, and she wanted to do lips again. I was like, look, it's not just lips. We got to also treat these little areas. Look at this line right there. If I just do your lips and you have these deep lines, it's going to look like old sad lady. We don't want that. And if your chin is set back, the lips are going to overpower the lower face. That's not going to look right. We need things to look balanced when we're doing them. When people do filler and they're just spot treating, a lot of times that can look unbalanced. That's when people think it looks unnatural because we're like, oh, they did their lip filler. I can totally tell they got their lip done. Everyone always says, I know when people get filler. Oh my gosh, I can totally tell. I'm like, no, you can't tell. If you just saw her walking down the street, you would not think she's done Botox and filler. But yeah, we did filler into her cheeks. Oh, I don't want to mark on that. We did filler into her smile lines, her lips, the corners of her mouth, and then as well as her chin to elongate the jawline. And so you can just see the harmony in her face. That's the goal. So this is settled. I tell people, 6 to 8 weeks to fully settle. Immediately after, you might look like this, a little poked up, a little swollen. That's normal. 2 to 3 weeks is the worst of your swelling, your bruising. If you follow the pre and post care that we send you, you're going to do good. And so this is why we do virtual consults. This is why we consult people before they even come into the office, so we can go through your questions, goals, tips on what to expect, how to prep treatments. We want you to get ready. Our patients come in and they're ready. They're set for treatment. They know about, they know the budget because we've already talked about the different areas and the costs. If they want financing, we have that. They're able to get set up. They know they're not going to book it and they're like, oh, I've got a long flight, or I've got a hot date tomorrow. I don't want you to be swollen and bruised for your hot date or your photos. So that's why we do consults. Okay, let me go through here. How can I book? You can book if you go onto my profile. The number is there. At the top of my page, call or text that number. The team can help you with getting set up. There's also the link where you can go directly and set up your virtual consult. But if those times don't work with you, or you're just I want to come in, text the team and they'll help you. I see all the messages that go through as well, but I have team members that just help me. And it's not just me that is here. My patients, we're all being seen with there's 5, 6 other nurses on our team, nurse practitioners, injectors, and they're excellent. So you need to come to London. They don't know what they're doing out here. I have patients from London that I see and that fly out, and I know what you're talking about. Okay, I want to do permanent eyeliner. will that dissolve if I get any peel done on my face? I don't think so. Eyeliner right here, we're not going to put any peel like right along your eye, so you should be okay. It's not going to take down. I need a lift in my late 30s, never had anything done. So we can talk about it where you're looking at trying to lift. And when we're looking at lift, I mean, I feel like these girls look lifted without doing surgery. That's the point. I'm like, we can get some real dang close surgical outcomes. And these are just, I'm in my like smaller clinic today and I'm on a break. And I just wanted to show you some of the photos that we have on the wall because I think it showcases like the before and after is really nice. So we've talked through her, we did chin filler, we did cheek filler to create a lateral highlight, filler to bring forward her jawline. We did some lip filler here over a couple of sessions. We did some under eye filler here. We did cheeks, smile lines, lips, jawline, corners of the mouth so it doesn't have the little sad lines right here. For her, we did cheeks, under eye, lips, and then into her chin. Okay, so this patient here, she was like late 20s or early 30s. Saw her over a couple sessions, came from out of town. Guys, we see people from out of state, out of town every time I'm in clinic. Somebody has flown in, so you'll see people with their suitcases. And I shout out, thanks guys for coming. We like prep and plan this. Someone said, I had 1 mil of Volux in the chin, brought 2 more syringes. Would it be enough for jawline and chin? Teresa. So it really depends on like how far back your chin is, how much definition you're trying to achieve, and what you naturally start with. When I'm doing chin and jawline, it's anywhere from like 1.5, if it's just the chin, if their chin is not really set back, to 2. So this is like 2 syringes here. This was like 1.5 or 2 in hers. And like, I also do it over sessions. So I do some, let it settle, we can do more. So it really depends on like what you want. If somebody has, you know, already a pretty good jawline and they're just trying to make it a little bit more defined, like look on me, this shadow I hit, you could hit. It's not going to take a lot. My chin has done like probably 3 syringes over the years. It just depends on what's going on. So that's why you got to assess if you have a very weak chin and the chin is really set back. I'm trying to see if anyone's chin here is super set back, not super set back. I have some other photos. I got photos all over the office when you come that can take more. Okay. Hope that helps. Okay. So she came in over a couple sessions and what we did. Oh gosh, one of the pictures fell. Okay, what we did here was some filler into her chin. Again, she wanted lips, but she knew like I can't just do lips and have my chin set back. So we did some filler into the chin. She wanted to balance this upper and lower lip ratio, so she wanted a little bit more fullness in her upper lip. She did her under eyes. You can't fully see it from this angle. And then she wanted the tip of her nose to be upwards and to camouflage the bump. And so for the nose, can you see? Some people want it up, some people want it straight. It's really up to you. Some people want to keep a little bit of their bump. They want me to soften some of the bump. So we can really customize it based on your goals and what's going on. She looks fresh. Like, I think she looks so cute. She looks like, again, you see this girl walking down the street, that girl, you're not going to think she's done a bunch of Botox and filler over her face. That's the goal. Okay. Here she came in. Hopefully you guys can see this. I'm going to make sure that I'm not missing anything. Here she came in and we did under eye filler, cheek filler, into the smile lines. I don't think we did her lips, so not her lips, but this around the mouth. So these shadows here, and then into her chin to give her a little bit of elongation. I have another side profile from her and like a 45-degree angle, really pretty to see what she was so happy about. She kept saying like, you got rid of my double chin, you got rid of my double chin. And like, it's not getting rid of fat underneath, but what we do when we're bringing forward the chin, it helps the underneath to look like a little bit more snatched and tight. Do I do PRF? Yes, I love it. We do PRF Easy Gel. So we take just your PRF and we go a step further where we're also heating it. So when we heat it, it makes a gel-like consistency. We're able to inject that in the face. It helps the PRF and your growth factors, your stem cells to stay in the skin longer than just doing non-heated PRF. And it also gives you a little bit more of a lift that you can see than regular PRF. So I do that. I love that. I'm breastfeeding, guys, and I've been pregnant and then breastfeeding for like 3 years now. So breastfeeding for 2 years and then pregnant for, a year. So I haven't had filler in a long time, and I love Botox and filler, but I've been doing the natural filler, and all the spots where I usually do filler, I've been pasting the natural one, and I like it. When I first did it, I was like, I don't see a change, because I'm very used to like seeing a line or seeing hollowness, volume loss, and putting filler in there and getting the immediate result. With the natural filler, it gets better over time, because wherever we place it, it's going to make new collagen. So Okay. Such slight changes have large results. So yes, that's the goal. I want it to look like you. I want it to look fresh. I don't want her walking down the street. You're not going to think she did Botox and filler. That's the point. You're not going to think she did Botox and filler. That's the point. Like, they look like themselves. Sorry, one of my photos fell because I hit it. Like, if you look at this, they look like themselves. These faces are not the same. And I know I'm in LA, so like I see a lot of these faces like morph to start looking the same. That is not it. You know, people are all trying to like run and look like one celebrity. I'm like, that's not it. Like, you need to look like you. Again, we treat all skin types, all skin tones. I'll go to the other side and show some more photos in a minute and talk through those. But like, it's going to look like you. It's going to look fresh. So she's just so pretty. She's so happy. They're all beautiful. Like, and they're going to say, you don't need anything. Yeah, I know. None of us need it. I tell them all the time, like, you don't need this. But if you want it and it helps you look fresh, like, yeah, let's do it right. Let's not look weird when we're doing this. Beautiful. She wanted a little bit more lateral cheeks. She wanted her cheeks to look pulled up. So sometimes the girls are like, I want it to look like I have a highlighter on my cheek. So we did that. Some laterals there. She did filler into her lips, but also her chin. So look at her jawline. Subtle, but big difference. When people say they want like snatched, a lot of times they're trying to get that highlight. They want a little bit of light in the chin as well. And also, if I just did her lips, guys, it'd be big lips, short chin. Gonna look bad. So don't just do big lips and have short chin. Okay, her came in and we did under eye filler, cheek filler to the lateral part, into the corners of her mouth, the lips to hydrate, her chin and her jawline. You can't see it from this side, but I have her other side profiles and you can just see the jawline enhancement. And she had sent me her little selfie. She was looking and feeling so fresh. She's just happy. Like, that's just it. Like, they just say, I feel more confident. I feel like I can go out and face the world and just not feel as self-conscious about, you know, whatever little thing that they're concerned with. Okay, I'm going to talk through some more before and afters, and let me see if there's other questions I haven't. PRGF, somebody was asking. I don't do that because it is not FDA approved and to be injecting in the United States, and it's not studied for injections in the United States. So I advise don't do that. That's pretty new to the aesthetic market, I want to tell you. And so I've been in this as a cosmetic nurse practitioner since 2013. Like, don't be the first to jump on new trends and treatments, guys. I see a lot of people do that. I'm like, you're putting yourself at risk. Like, if this stuff is not studied well enough, you just don't want it to come back and bite you in the butt. And I feel like it's mixed. Some of those results I've heard on the PDGF where people are like, I really like it. Other ones where they're like, bad outcome, or I didn't see much. So just saying it where I don't want you to, I just want you to be mindful about the treatments you're getting. If you're getting treatments, make sure you see somebody who sees people that look like you, that can show you lots of before and afters, read their reviews, ask questions, do a thorough consult. Like, don't be smart. It's like your face, and I want you to be smart. But PDGF is not FDA approved in the United States for use for injections. Don't do it. Like, it's too new to the aesthetic market. I don't advise it. So, I mean, do what you want, but like, I'm going to tell you, I'm always going to be real. Gosh dang, if you stay on my live long enough, my patients start jumping in and they'll be like, I've seen Ginille for so long, and Ginille will straight up tell you no. I tell people no all the time, not in a mean way. It's not my way or the highway, but a lot of people, they just don't know. And so I'm going to be like, no, that's not realistic. I had a girl yesterday that wanted like 1,000 units of Botox in her. She was like, get rid of my calves, get rid of my traps, get rid of my arms. I was like, no, like, I'll be real with you. And she's like, do Kybella over my whole stomach. Like, I want all the fat gone. I'm like, it's not gonna work like that. So I'll be real and I'll tell you. Okay, what will jawline filler do? I don't want it to look like a square. Teresa, that's really good. I've got jawline filler on people that I can show you. So when you're doing jawline, I think that's good that you bring that up. We want it to look good. And for my patients, period, not just jawline, any part of your face. I'm like, I want you to look good and fresh from all angles. We don't want it to just, thank you, hearts to you, I appreciate you, confettis. We don't want it to just look good from the side. Like, I need you to look good from here, from every spot. That's the whole point. For women, when we do jawline, I tell them, if we try to make this too defined at this angle, it will start to widen and make it square. Boys, or men, I'm like just looking for photos so I can show you some guy photos. Guys tend to like the square jaw, so they're okay if I like keep building this up because they think it looks more masculine. Girls, I'm like, dude, if you want me to chase a straight jawline, it's gonna start to bulk up, and like, if you want that, that's fine, but like most women don't. So it's something to keep in mind. I have acne scars, but I also want to snatch jawline. What should I do first? Edith, I would work on skin first and then injectables. And I love injectables. Like I am an injector through and through, like on the face. That is what I do. That is what I study. That is like God's gift for me to do. But I will say acne scars specifically, when people can get, you're so sweet. Thank you for the hearts and the flowers. Joyful. When people have their skin just looking its best, they feel way more confident than anything, especially for somebody with acne scars, because they're kind of like, dude, I have dealt with this for so long. So I would really work on acne scars, things you can do, tretinoin or retin-A, skin treatments like microneedling, bio-repeel, like, I don't know if you're black around, but those are, you want to make sure the treatments that you're doing, aerolase laser, like that they're doing, are safe for brown skin. Is it the same thing as regular filler, just the technique is different? Heavenly, let me see what you're talking about. What is natural filler? Natural filler, so we draw blood from your arm, we spin it in the centrifuge, it separates out, so we draw blood from your arm, spin it in this spinner here, it's going to separate out your growth factors, your stem cells. This is a heater. This will like put your syringes of your growth factors and stem cells, or if you've ever seen like PRF, PRP, liquid gold, that part where we heat it. And so nothing is mixed inside the tubes, which is really nice because some people are not candidates for filler or some people don't want filler. And so we have this as an alternative. Wherever we inject this, your body will make new collagen over time. And I was mentioning earlier, but I've done it all over my face. And my patients have done it all over their face. And I've had some people be like, I don't want to get filler and I only want this. And they've been very happy with the results where they're like, I don't ever feel the need to have to get filler and I feel safe because this is from me. Now, I'm not going to bash filler. I love filler. It can be temperamental. You know, you want to do it in the right person, in the right area, the right amount, the right filler. So that is really important. But the natural filler, like, you can't go wrong with. I will say my patients in their 20s to 40s, 50s, they really like it. The healthier you are, the younger you are, the better your body can make new collagen over time. So I'm like, don't come in here and have a crap diet because I'm about to draw your blood. And like, that's going to be reflective of the growth factors and stem cells inside of you. Don't be drinking and smoking and doing all that because all that's reflective. And like, you also want your body to have a good environment to make new collagen. I've done it in my patients, I've done it on every part of the face for my patients. And in me, because I'm breastfeeding this big 2-year-old baby that also eats cheeseburgers and then is like, give me a drink, ma. I can't do filler. But I've done it in my temples, my under eyes, my cheeks, my smile lines, my chin, these corners of my mouth. And like, I really like it. And I'm 38. I have 3 kids. I usually breastfeed these babies till 2 to 2.5, and I usually get really hollow and I start to feel pretty self-conscious just because they sucking the fat out of me. With this natural filler, I don't feel like I look as haggard. This third time around, being 10 years older than when I first had my other kid, or almost 11 years older, I was like really hollow, like after the fat loss, and the second baby too. And so now with this natural one, I've done it multiple times, hitting up different areas. I'm like, I don't feel so self-conscious. Like, it gets better over time. I'm not like trying to rush and get to filler. Like, somebody asked me, like, oh, when you stop breastfeeding, you're going to go back to filler? I'm like, there's nothing that I really am like bothered by. Maybe I'll hit like this spot up. Like there's nothing like killing me. Like, I don't know. I'm like, I just throw the natural filler in there and it's been good. Now, if you want immediate results, go with filler because it's going to be that instant. If you want something really structured, you know, when girls are trying to like get the nose definition, I'm like, I don't think it's going to give you like nose definition structure. Same for lips. It won't make a crisp border. But what it can do is like help to hydrate, to give a little bit of volume, but it's not a big volumizer. Okay. How does weight loss affect PRF? I think if you're having a healthy diet, you should be okay. So right now, even in our office, we have Zepbound. We have like a whole body and wellness program where our patients come in on a weekly basis. We go through a lot of questions. You guys, I talk a lot. My team talks a lot. But we want to make sure you're doing these things right if you're doing them. So we have patients that are losing weight, 20 pounds, 50 pounds, all that. They're good as long, but we're really big on like, what's your nutrition like? What's your hydration like? Are you smoking and drinking? Like, those things still, I think it's just naturally the lifestyle. Yeah. Can I suggest a good collagen supplement to take? I don't know a specific one, but look for hydrolyzed collagen peptides. That's what I have heard. So, okay. Can I slim your nose with Botox? You can prevent nasal flaring. So if your nose, when you talk or smile, like these nostrils are jumping around, you can put Botox there to help minimize them from flaring so much. And then you can like lift the tip of the nose with Botox. You can soften these like bunny lines with Botox. It's not going to make your nose super tight. However, you can also do filler. I gotta like open up iPad and like go through more photos than these 10 I have on the wall. You can do filler to camouflage a bump, lift the tip of the nose, create a highlight down the center of the nose. All of that can make the nose appear thinner. If your nose is really wide, I had somebody come on recently and their nose was really wide and like, I want my nose like smaller. I was like, that's a surgery. So also understand there's limitations with the cosmetic treatments, even surgical, but just understand what you're looking. If you want to elongate your chin with filler for a more balanced profile, will it make it a big difference straight on? Straight on, let me see somebody straight on. Oh, I have some people. Okay, let me show you. So she's straight on chin filler. So from the front, it still looks pretty similar. So when I'm doing chin filler, the whole purpose and like what I'm doing, we can give a little bit of length if somebody feels like their chin is short, so we can lengthen. We can elongate if they feel like their chin is back. Here's one. She feels like her chin is back. And so you can see back and then her after forward projected. Makes the jawline look straighter, makes the jawline look elongated, helps to camouflage a double chin, helps us dimpling here, helps so that her features, it's not just her cheeks and her lips are dominating, that's where most of the highlight is hitting. And now she has some light on the lower face. So those are like and then what other things you can do with chin for guys, they want me to like make it more masculine, more square. I can create the highlight to be like here. If girls want to, she's an example. She felt like her chin, oh gosh, I'm gonna drop these down. She felt like her chin was a little more square across and had a slight cleft. She like the little indent there. She wanted that. She didn't want it square. She wanted it slightly rounded, and she wanted me to fill in the cleft. She's another chin, a little bit more square, and then she wanted it more heart shape. So she wanted it more forward. Dang, I do a lot of chins, guys, and she's another chin over there. Like chin makes a big difference on the side profile and then from the front too, depending on what we're trying to do. If I'm trying to lengthen and give some light from the front or forward projection or change the shape. If a patient doesn't, you guys don't have to know. I feel like I'm saying a lot of like, this patient wanted this. Sometimes they don't know. And they're just like, can we talk about it? Can you tell me what you think would balance your face? I will talk to you about what I think. I will show you patients that remind me of you if we're doing a consult. If you're like, I just don't know anything. Like, I'll show you patients. I will ask you to show me pictures of you when you feel your most beautiful. I'm looking at how you angle your face. So if somebody's always taking their picture from down here, I'm like, oh, they feel like their lips look fuller if it's low. If somebody's taking it from, like, I'm looking at how you take the pictures. I'm looking at how light hits off your face. There's a lot of things. I'm looking at you talk. I'm looking at you express. Like all this is like going on as we're going through the consult. I'm listening to you talk to me about your job because, I'll treat a pastor and then 10 minutes later I have a sex worker and like, they're going to be two different types of looks, I ask a lot of questions and it's like, as I'm doing this, I'm like going through, it's all of that is going in my mind and my team's mind. And they're like, okay, she said this, or he said this and this and this. And so that is making me think this would line up with them. Oh, she told me she doesn't want any downtime with any treatment. Okay, so these skin treatments are going to be better versus this one. Oh, she wants to go aggressive. She's done a bunch of stuff before and she didn't see a difference with it. She needs something more aggressive. Okay, we need to stack and combine these skin treatments. Oh, she wants nobody to know. She's so afraid of filler. Okay, we need to go the natural route. Oh, she wants to see immediate results. Okay, we need to go the filler route. Oh, she's like losing weight when she's trying to like just have some collagen stimulation, like trying to kind of preserve. Okay, we need to go collagen route. Like all of these things. This is why we got to talk. And I mean, people will get on here and we'll chat and I'm going to try to keep going through your questions. But I say this stuff because I want you guys to be mindful. There's a lot that goes into it as a provider when we're doing your treatment. And I don't want you to just randomly pick a place because you see a Groupon. Like, don't do that. I'm like, it's your freaking face. Like, I am praying all day. Like, God, continue to bless my hands and like serve the people that are trusting me to do this. And like, let me help them feel beautiful and confident in what they do. I don't take this like lightly. And you don't want your provider to take it lightly. And people, the patient yesterday told me, the one that was also asking me for 1,000 units of Botox and stuff. And she's like, Ginille, when we did our consult, and I've been treating her for probably 5 years, she goes, I went through 20 people before I decided to go with you. I was like, I didn't know this. You've never told me. Like, I know all about this girl. And she was like, yeah, I went through 20 people. And she was like, when we did our consult, you told me no to the lips. And I said, oh, we were talking about your nose. She goes, we were talking about my nose. And then at the end, I mentioned, I'm thinking about my lips. And you said, no, you don't need that. And she's like, you just kept moving on. Again, it's not my way or the highway, but looking at that girl and her features, like if I could do lips on her, but like, I don't want to throw the balance off. And she's so naturally pretty. And if you're kind of like not sure you want to do something, I tell people, I'm like, don't just like play around with your face. Like, I don't want to be the one playing around with you. Okay. Let me try to make sure Key said, yes, as we get older, the chin shrinks or something. We lose bone here. And so the chin starts to go back, starts to get dimpled. People don't know. A lot of people think just like they come in there, just I want my face like this. They just keep pulling it up. I'm like, first of all, that's surgery. Second of all, like I can't do that with this. However, like, I'll talk to them about where we can create the highlight so it looks lifted. I'll talk to them about what they can expect. I'll show them faces. Like, is this what you like? Or are you trying to get something different? If you want something different, like consult, do all your consults. Don't rush your treatments as we go. Okay, I need mine projected. I just don't want to change it too much from the front. From the front, the chin filler is not going to look too much different if you're not trying to like change shape. Yeah. Okay, what about neck wrinkles? Oh, these bands that I need a Botox and want a Botox. So neck Botox can help tighten here, tighten that up so it doesn't show. It can help, so that'll make the jawline, like it'll help the jawline look a little bit tighter because this muscle connects there. Dang, I should do that. It'll make the neck look a little tighter, more elongated. If you have like sagging, hanging. Oh, first of all, I haven't said this one time. You guys all need to be using sunscreen. Like use your sunscreen face, neck, chest. Don't just do it face. Don't just do it once a day. Like you need to reapply. Like when I leave clinic and I'm driving, I'm reapplying sunscreen because we're in the sun, especially if you're in LA. But for your neck, sunscreen, retinoid, skin treatments like microneedling, laser, Aerolase laser, and the bio repeal chemical peel. You can also do a little bit of Botox there. If you have like these horizontal lines that I have, you can do like really thin filler into them. If your neck does not have like too much fullness, if there's a lot of fat, like I wouldn't do, but you can do a little bit of thin filler into the necklines. Okay, let me see if I hit any other. Do I remove DPN too? Yes, Edith, you can do that with the laser. And where are my photos? Gosh, I'm just like look around. I had the nurses zap me the other day, so you can even see I had DPN. I had a bunch, guys, on my face and my neck after. DPN, guys, are the dermatosis papulosa nigrans. They're like these little moles that you can get. They're benign. There's nothing wrong with them. It happens with aging. Think of what is that man's name? We know him. He's a black actor. He's old and he has them all over his face. Everybody knows him. I'm just forgetting his name right now. He's real cool. But those that happen on the neck, on the face, on the chest, anywhere, you can zap them off. So mine right now, I just had some on my chest. They weren't even that bad, but they're going to look darker. This was when I was in Vegas. They zapped before I left. They get darker and then they shed off. So I used to have a bunch on my neck after my pregnancy. They are gone. I have nothing. My husband was like, what is all that on your neck? Like it came up hormonally and on my face. And so you can zap those off with the laser at the same time you're doing your laser rejuvenation treatment, and you can do your microneedling the same day. That was for Key. I'm trying to scroll through these. Located in 3 locations. I've got 2 offices they're under Ginille Beauty Aesthetics or JASI Skin and Wellness because we're switching the name this month. In Las Vegas, we just opened there on the Summerlin side. And so you can call or text the number in the top of my page, and we can help you with getting consults in. I should also keep probably going through these patient before and after. Morgan Freeman, they knew. Thank you guys. How did you remember? I was like, you guys knew what I was talking about. Thank you. That's funny. It's little wrinkles in the middle of my neck. I need a mini Nefertiti Botox. So yeah, if it's like these, people will put a little Botox. I was doing this on a bride yesterday, and she was like, Ginille, like I did some on her. You never want to like weaken this muscle too much because you might feel like a bobblehead. But I did some, and she was like, it was so great. Like it tightened my neck. It tightened this little part up. I want more. I was like, okay. So we did some yesterday, and it just helps tighten. People do like that. I like it too. Some people, when they talk, these bands show a lot, and they will like it because it just tightens it up. Okay. You guys knew that person. That's so funny. Is BioRepill good as skin pen? They're different. Jackie, you can do them together. I love BioRepill. I think right now my favorite combination in our skin treatments is, and I don't like picking favorites because I like them all. I use them all and love them all. But I think the BioRepill with the Hydrofacial is my favorite. It used to be the Aerolase. I love the laser. I love the laser so much. But the BioRepill, I feel like I look more glowy. I'm going to do it tonight. I think I'm going to do it tonight. Probably my husband's going to ask for it. And he never asked for anything. He's like, can we do that skin thing again? Anyway, the BioRepill, really pretty glow, brightening, no downtime. Anything I talk about is going to be safe for all skin types, all skin tones, because we see everybody in here. It, like deeper exfoliation, helps with acne. Because it's drier out, I like it with the Hydrofacial because it like hydrates, and you don't even really get that dry with a BioRepill, but I don't want to flake at all because I'm on the screen talking and making videos and seeing patients, and I wear a mask and I don't want to be itchy. So BioRepill with Hydrofacial is my favorite. But I have people come in all the time and they'll stack different treatments. Any of our treatments, you can stack them together. So Skin Pen, really good for resurfacing, acne scars, skin texture, like necklines, dark spots, pores. That one has a little downtime. So the reason Skin Pen is not my one that I personally pick is just because I'm doing patients and I got my hair on my face. You can't touch your skin for like 48 hours. I got babies. I don't want them touching my skin. It's like an infection control thing. Because with the Skin Pen, we're making these like micro injuries in the skin. Your skin comes back to repair itself. It helps with fine lines, pores, collagen stimulation, texture. You got to stay out of the sun. It gets a little scratchy and like tiny little micro scabs, and then they fall off over 1 to 2 weeks. Safe for Black and brown girls. It just depends. Like I'm one that doesn't like downtime. Some of my patients, they want downtime because the more downtime the treatment is, guys, the quicker you see results. So for me, because I'm doing all this, I don't like downtime. So it just takes me to be doing these no downtime treatments more frequently. The higher the downtime, the quicker the results. We still got to be safe and considerate of skin type and tone when we're doing it. Okay. Thank you, Amanda. You're beautiful and God bless you. Okay. Don't say you hate your nasolabial folds. You're beautiful, lucky. Okay. Nasolabial folds, the smile lines here. I will say, I tell people, everybody's always like, get rid of my smile lines. Tips for smile lines. Like, first up, don't try to get them all the way away. If you try to chase and make there be no line right there, it's going to look weird. Your face is going to look pudgy. You don't want that. You can use filler if you want an immediate effect. You see the line, you want me to soften it, we can pick a filler. There's different types of filler. I can show you in my cabinets. We have a bunch of different ones. I choose different ones depending on who I'm treating, how thick their skin is, what's their concern, what the area of the face I'm treating. So we have thick ones, a really deep line. If I have somebody that has a thinner skin, the line's not as deep, we're going to go softer filler. So different products. This is why I'm saying there's a lot that goes into it, and I don't want you to be willy-nilly just picking whoever to inject on your face. Be thoughtful about who you're choosing and do your consult, do your research. Don't rush your face. So that's one thing with smile lines. Filler, you can do the natural filler. Draw your blood, spin it in the centrifuge. This one, spin it down. It separates your growth factors, your stem cells. We take that out. We put it in this. This is a heater. It heats it up. It makes a gel. Wherever we inject it into the smile lines, it's going to make new collagen over time. So it gets better over time. That one is great. You're not gonna have any issues with any of these, but like really you can't have any issues with this one because there's nothing else mixed inside of it because it's all made from you. So you're not gonna have any allergic reactions. You're not gonna have any bumps and lumps. Again, I love filler. I don't really be getting like bad outcomes from it because I do it so much and it's what I specialize in. And we know what to tell the patients. We know what to expect and all of that. But still, there is a higher risk with filler when we're doing the treatments for a poor outcome. Low risk if you pick the right provider. I can talk about filler safety too in a minute. Other thing you can do for smile lines are collagen stimulators like Sculptra or Dilute Radiesse. And so wherever you place it, it'll make new collagen over time. Instead of that one being a collagen stimulator made from you, it's made from a company. The other thing when you're doing smile lines, I tell people is not just this line. Why is this line happening, guys? It's because we're losing volume. I need to get like something to show you the different fat pads. We have different fat pads on our face. We got a fat pad here, Fat pads here. So as we get older, these fat pads, they start to separate. We'll get a line here. They start to sink. So this, people will get this line, and they get the smile line. They get this corner of the mouth line. This one keeps dipping, dipping, dipping. It makes a jowl. You can see it on me where I just like outlined, like I'm just trying to make it look more indented to show here, here. I can show the patient before and afters. So I'm like, if this line is happening because now these fat pads, you know, oh, you lost weight, and so you don't look as lifted. Hi, I see you over there, Milton. I should talk about your picture in a minute. One of our patients that I love. Okay, if this is happening because fat pads are separating and sinking, we need to be thinking about the whole face. I don't want to just fill this line and then your cheeks are saggy, but you have a blown out line, but your cheeks are not lifted. No, we got to do a little bit back here to make it look lifted. We want to treat this corner of the mouth. And if they only want this line and then and this is soft, but then this is deep and saggy, it looks weird. And you don't want to have big cheeks and then sunken temples. Like that looks bad. So it's your whole face that we got to consider. We don't have to treat every whole face, every part of every face, guys, but we have to look at your whole face and like say what is going on. So it takes a lot of time that it doesn't take me a lot of time. I'm looking at your face and I'm like, oh, is that? But it takes me time to explain it to you so you can understand. But it's not just line chasing. So if you just go to a provider that doesn't really know what they're doing and they're like, you're telling them just do this line and they're like, okay, I'll do that line. The outcome could look weird. So it might not look weird if your cheeks are still lifted and you have good fullness and you just have a little bit of line. It might look fine. But, you know, if you lost weight, 20, 30, 50, 100 plus pounds, that girl over there lost 100 pounds in the middle. I'll talk about her thing in a second. You know, the face is not going to look lifted. It's going to look different. And so how I inject how the face is aging, where we're losing bone, where we're losing fat, where those fat pads are separating. And so that is why our patients don't look weird when they're walking around. And I also will tell people, no, don't do something. Okay. I need to schedule a consult. I haven't found a provider in my area that I trust. I'm ready. Craven, you were talking to me the other day. Like, you can do it. You can text our team. I'm like, girl, I've been seeing you. You can text our team. You can you can do it. Or we can jump on here if you want. We can talk through here. Some people will do that. You're funny. I just remember you can just schedule it. I mean, I will do them. My admin days when I see patients, all I do is see patients, and I go the whole day and I'm like focused on patients and I can't do the lives and I can't make videos and stuff. When I'm not seeing patients, I'm doing consults for my patients to like have them prepped for their treatments. But yes, we can talk through it. What would I suggest for this? The sagging of the face. If the face is sagging, I got to see you, but typically that's when they're saying this is all pushed down. So that's when we might be doing a little filler here, camouflage this jowl. You can see it. You can't really, I have it like slightly here, but like you can camouflage this jowl to make this look straight. I can show you different faces. And if you tell me like how old you are and what your thing is going on, I can kind of show you faces or if you want to jump on there, we can talk. I can show you hundreds of photos. These are just some of the patients that we have on our walls. We try to show all skin types, all skin tones, all the ages. If you come in, I'm going to be showing you got this, you got this. Oh, this is somebody that looks like you. My goal is for you to be able to see yourself in somebody else, and for you to see natural results. And, you know, for some people, they might think this is too natural. I'm like, if this is too natural, that's totally fine. Like, it's okay. Like, you can find somebody that'll do overdone work. Just find your provider. That's the biggest thing. Okay, what's the ultimate skin glow? Is it best for acne scars and hyperpigmentation for dark skin? First, before you start doing treatments, you got to do sunscreen. If you're not doing sunscreen, I'm like, don't come. I don't want to take your money, dude. If you're not using sunscreen, like I'm going to do these treatments on you and then you're going to be driving around, you're going to get sun on your skin, you're going to get more hyperpigmentation. So, and it's hard to treat dark spots and hyperpigmentation on black and brown skin because we can't be as aggressive on like the lasers and all of that. Like we have to use them safely. So first, sunscreen. If you use your sunscreen, next, if you can use a retinoid at night, that will also be great. From there, we can do, she said acne scars. Acne scars is going to be like go in there with the laser and the microneedling and the peel if you can tolerate all three. In the beginning, I usually don't start somebody that aggressive if you've never done any treatments. So I might say just start with like the laser and the microneedling. I kind of go a little slow because I want to see how I respond. You yourself want to see. But I have patients that safely do skin pin microneedling, the Aerolase laser, and the peel, all bio-repill on the same day. Now, they are going to have a little bit of downtime. Remember, the more downtime you have, the quicker you can see results. Edith says she uses sunscreen. Go ahead. Make sure you reapply it too, especially if you're doing skin treatments. It's a big one. Hi, T-Bag. I hope you're doing so great. Okay, is it best to just do skin treatments over Botox? Which would last longer? I'm always going to say do skin treatments and skincare. Like if you're like, I can never do a skin treatment. Some people are like, I don't have any dollars. I'm like, you can stay out of the sun. That's for free. Stay out of the sun. Put your window coverings. I always have like if you come in our office, every window is covered, like always. Stay out of the sun is free. Use sunscreen. Skin treatments, I think people love, and they feel way more confident when their skin is glowing, and then they're not trying to buy makeup and cover it up. Like, we're not wearing makeup. Like, no, we're not wearing makeup in this office. Our patients aren't wearing makeup. I mean, if you want to like go out and be glam for something, sorry, I'm taking my jacket off. You can, but like our patients we want their skin to look fresh. Sorry. Give me 1 second. So skin treatments first and foremost, and then the Botox filler. I love Botox. Botox is going to be great for your like mad lines, the forehead lines, around the eyes, chin dimpling. TMJ Botox, that's a good one. If you've got like functional, I got TMJ, teeth pain, jaw pain, I clench and grind my teeth, do TMJ Botox. My masseters and my temples hurt, do that so you're not breaking your teeth. If you break your teeth, that's a whole nother thing. You know, you don't want to be dealing with that. Okay, so skin treatments are always going to be like the way to go. I love Botox though too. I love them all, guys. Like, I would not put you on, and I would not be on here making videos every single day for the past 5 years and dedicating my life to this since 2013 if I didn't believe in it. Like, at first I answer to Jesus, and like anything I do, I'm not going to be like wronging him. Like, this is the gift he gave me. I'm going to do right to the people. So, I love all the treatments. Like, if I say something to you, it's a recommendation from like my whole heart. And the team, same thing. Like these girls, I would never put you onto these girls if I didn't like fully love and trust them. And they are so thorough and so thoughtful and excellent providers, like excellent. I can only work with excellent. I'm just a little extra. I went to Stanford. I went to Duke. I'm a lot extra. My husband went to Stanford. Like, we don't play around. Anything I do is going to be 500 million% infinity Google Pet. Like, it's just what I do. I pray all day because I want you to have a great outcome. But a lot of that comes with us communicating. And so when I've had people come and they say, you know, I went somewhere else and and they did this and I didn't know what they did and I didn't know why. I'm like, were you talking to them? Like, and they were like, they didn't really say and they just did stuff. That's not how it is. I probably talk too much. I'm sitting here yapping on this thing. But I want people to be informed. I want them to be thoughtful. I want them to be safe. I want them to understand what we're doing and why we're doing it specific to them. So they're not going home like, what did I just do? And they don't, oh, I'm swollen. Is this normal? Like, we go through all of what to expect and what's normal, what's not normal, Very important to us. And it's very important, period. Because there's a lot of people out here that'll just like take your money and like do bad work and be like, sorry, and leave you. We don't want that. You don't want that ever, period. You're the very first person to convince me of Botox. Hi, Spanish. Go Spanish now. I told you guys to go follow him the other day. Your recovery. He's asking questions, but he knows. Milton, I love you. I'm going to show you freaking pictures, Milton. Go follow his page. This is a really good page if you want to learn Spanish. So he said, how do we use recovery serum? I love the Recovery Boost. I love anything I offer you guys. I'm not going to lie about it. Recovery Boost, great pre-care and post-care. We use it on open wounds. So after microneedling, we use it after all of our skin treatments. Helps with redness, irritation, dryness, helps to recover the skin faster. So any skin irritation, open wounds on my kids, if they have cuts, I put it there. It heals the skin really fast. That is everyone's favorite. That's like our #1 selling product besides our sunscreen. Okay. So I'm going to talk about his pictures. I haven't talked about it yet. He's so great. And we go live and we talk about it. So he came to me, we did our consult, came in feeling a little bit tired underneath the eyes. Limitations. I said, okay, what do we do? Do you get puffy underneath your eyes? I don't get puffy. I don't cry a lot. I don't have bad allergies. Okay, you're a candidate for under eye filler. What we can do is camouflage this eye bag. So this little eye fat pad. We all have fat pads underneath our eyes. Some people have them where they bulge out. Some people's are smaller. Everybody has them. We just can't take them away non-surgically. We can camouflage them. So you see that little part right there? Little baby bag. Little baby bag right here. We can camouflage them. So I did filler underneath here and here to bring the skin up. He still has a teeny baby bag, but you can't really see it. And that's the whole point. Also, his skin is skinning, and we did some Botox to soften the lines. Now, if you see this man on the street, you're not going to think he's done Botox and filler. And like, that's the point. We've done some jawline and chin stuff. Hair. We've done hair restoration. Those are really good before and after photos as well. For any thinning, for shedding, we've done. So there's a lot of things you can do. We do this over time. Like, I've been working with him for years. A lot of these patients, it's like for years, 5, 6. I have some people I've seen my entire career and I see them and like, they look fresh. They look younger as they get older. And like, that's the point. I want it to look like you. I don't want it to look weird. I don't want it to look overdone. Yeah. And like, we just have a talk. So sometimes he'll be like, should I do this? I'm like, oh, I don't think we should do it right now. I think you look good. Like, just wait. And I'm like, okay. I'm like, is it really bothering you? He's like, no. I'm like, okay, wait, let's not do it. Yesterday, the girl was like, it's 2 years. It's time to do my nose. Her nose looks perfect. I was like, what do you want to do? She said, well, you said it's going to last for 2 years. I said 1.5 years to 2 years, but it could last longer. She's like, I don't know. Should you do something? I'm like, no. Do you see anything to do? She's like, no. I was like, we're not going to do anything for it. So that's one thing to keep in mind. Hi, I hope you're doing so great, Kay. Okay, are you in LA? How soon can I get an appointment with you? Edith, yes. Come in. We also, Edith, have a Black dermatology nurse practitioner on our team. Her name is Niani, and she's excellent. And I say that because she is, there's not that many like women of, skin of color dermatology nurse practitioners. And I know you were talking to me about acne, scarring, and hyperpigmentation. Like, I think have an appointment with her too. She's awesome. We all do all the treatments, but I'm like, I would see her. She's so great. I'll see you too. Come in the office, just call or text, tell the team. So if you text the number and you say, oh, I was talking to Ginille online, I'm Edith, I'll know. And then I'll tell them to help you with getting set up. Do lipo injections work? Are you meaning like Ozempic, Zepbound? Yes. If that is it. And I have my family on it, guys. My brother has lost 35 pounds. And he started at like 250 and my aunt has lost like 30 pounds. I have patients, it just depends on what their goals are. The girl in the middle, she didn't do the program with us, but she had lost 100 pounds. And so the thing is with weight loss, sometimes people will notice changes in their face a lot of times because we start losing fat in our faces as well. So she came in, I'll go over there in a second, and she felt like her face didn't look as lifted. She felt like she looked more tired because she lost fat. This is a little exaggerated immediately after because she's swollen here. We did a little filler into her lateral part of her cheek, into her chins, into the corners of the mouth, underneath her eyes, her lips. And so we're trying to create that like highlight up. We're trying to restore volume. So that's something after weight loss, people will be like, I just don't look lifted. Like, I feel like I'm more sunken. I feel like I look more tired. I feel like I look older. And I just lost, some weight. I did 30, 50 pounds. I'm happy here, but what's going on in the rest of my face? That is a concern, so we can do that. If you're going through the weight loss process, you can do collagen stimulators. You can do regular filler. You can do the natural filler. So we just have to talk about like what you want, how much is it bothering you? How soon do you want to see it? We have to talk through your goals. Other things people might notice with weight change is, or if it's rapid weight loss, they might notice hair thinning, hair falling out. So we have a whole hair health program. The device is covered right now, but we do a scalp detox facial. For anyone that has like serums, anything on the sweat, anything blocking the follicle from growing, we're trying to debride that, like trying to clean it out. People, even if they're like, I just washed my scalp, we can still see all the stuff that did not get picked up when you washed the scalp on your own. And we can show it to you right after. So we're trying to cleanse the scalp first, and then we do the same where we draw your blood, we spin it, we separate the growth factors, the stem cells, we inject that wherever you're noticing hair loss and thinning. And I have some really cool photos I have to show you guys. Maybe I can pull up an iPad. And it'll help restore hair, which is great. Okay. I don't have my team right now, so I gotta pull up these pictures. Okay. Let me see if there's other things. I sent a text, Edith. Okay, cool. You know who else needs to send a text is Caribbean, because you've been talking to me a lot of times on here. I want to get it, but I'm afraid of the risk. Tell me what you're afraid of, Peach. And also, if you're afraid, I tell people, don't rush it. Like, it'll be here. Like, do your research. I don't want people they're gonna be nervous because they're getting injections, but like, I don't want them so scared because like you're gonna freak yourself out. You're gonna freak yourself out if you're swollen or if you're bruised. So I'm like, just wait till like mentally you feel like ready. Don't just rush stuff. But I can talk to you about any risk of any of the treatments. Biggest risk with these things with filler, it's going to be the most probably high risk thing, is going to be what you want to look for, because I hear that patients don't even know that you can have, risk with these. When we're doing filler, we want to make sure we're not blocking blood flow off. We got blood vessels, our whole face, our whole body, how all the blood is running through the body. So we don't want to put too much filler in any spot where blood can't move like normal. And so what we're looking for when we're injecting as a team, we're looking to make sure that your skin color is normal. It shouldn't be paler than normal. If it's paler than normal, I'm gonna kind of show you on my arm, I'll press. I'm kind of pale anyway, guys, because I don't know. Okay, if I press, okay, I don't even know if you can see. Press on your skin and you can see, and it kind of like gets a little bit lighter. And then it goes back to like your normal tone. If it's pale and like staying pale, that means somehow blood is not getting to that area. That's where we'd be concerned. If you had extreme pain when you're doing this, you shouldn't have extreme pain. Extreme pain also means, could mean blood is not getting to that area. You shouldn't have any vision issues. If you had any vision issues, it means somehow are we blocking blood to your eyesight, to your eyeball. We don't want that. We want to make sure no pain, no extreme pain, no vision issues, skin color is normal when we're doing this. If you had any of those signs, it could mean somehow we could be blocking blood flow off. So at that point, we would dissolve the filler. And we stay stacked with filler dissolver just in case of an emergency. I've been doing this since 2013. This is all I do. I went to Stanford, I went to Duke. This is what I'm dedicated my life to, even though I'm like, this is like one of the riskiest jobs. Can I just do an easy job? Not this risky job, but this is what God blessed me to do. I've never had to dissolve anybody for any emergency ever. So it's super rare. I just tell patients, like, this could happen. This is what I'm looking for. This is what I'm asking you. And if you've ever been treated by me for anything, the patients know I'm like doing this all the time. I'm like, you okay? I'm gonna do a couple injections. You okay? I'm kind of quiet because I'm focused. You good? You feel okay? And I'm asking, every time I'm touching the skin to check that skin color is normal. So we know what to look for. My team, they know what to look for, because I'll have somebody always like helping me with the injection. Like they're tapping the shoulder, they're handing me stuff. So I have like an assistant, they're looking too at the face. They know. So that is the worst. And like, that's a serious complication. But besides dissolving the filler, you can also do things like bring oxygen to the skin. So we have like a whole device that I pay for that I never ever use, but I just have it for emergency, that like it helps to bring oxygen to the skin. So if there was something, we can apply this. It helps to make the blood vessels more open, bring oxygen to the skin. So super rare, but it can happen. It's also going to be way more rare in somebody that knows what they're doing and really understands like the blood vessels, where they lay. I think any part of the face is a risk. So people are like, oh, this area is not risky, right? I'm like, I think any part is a risk. Everybody's blood vessels, even if I read every textbook, everybody's blood vessels could be a little bit different. Texting me, they just said, were you talking to Edith online about skin pin? That's funny. Okay, so she got you, Edith. I don't even remember what I was saying, but I've just been doing it a long time. So textbooks, they're going to show us where the blood vessels lie. However, everybody's can vary a little bit, and people's faces are different. And if you had surgery, your face is going to be a little different, like where your blood vessels lay. So I think every spot is a risk when I'm doing it. So when I'm doing it, I'm not putting a lot in one area. So I do a little bit more pokes because I don't want to be shoving a bunch of filler into the wrong spot. More pokes, but every single time I'm pressing, I'm checking to make sure that skin color looks normal and not pale. You good? You good? You alive? And they're alive. But we're kind of extra. We're really, really extra. Okay. Any pics of clients who had deep smile lines? I got to pull them on iPad. And then, remember with smile lines, my goal is never to get them all the way gone. I feel like I've done it for a couple people and I'm like, okay, that actually looks good. But like for the most part, I'm like, you just don't want to like be puffy. So I'm like, keep a little bit of a line because you're going to smile. It's saying my live is going to end. You're going to smile. You're going to move your face. We don't want it to look weird. Okay. But filler, swelling of all of that. I'm a tough cookie. Oh, for filler. That's what you're saying, Peach. I heard the probability of thyroid cancer can be high for Zepbound, etc. For thyroid cancer, or are you saying, so for Zepbound, there's a puppy. If somebody has thyroid cancer, those are the ones we don't treat. So maybe, I don't know if I've seen anything saying that it makes the higher risk for thyroid cancer. It's in the studies and on rats, they were saying that the rats in the studies that did Zepbound, if they already had like this thyroid gene where it was showing that they had this higher risk for thyroid cancer in the rats, that they had a higher thing. But if you haven't had Peach, if you don't have any thyroid issues, you should be okay. In our program, you guys know we're extra here. We don't just give you a shot and shoot you up and let you go. I'm the most extra of everybody. It's very ridiculous. I could probably see a lot more patients if I wasn't so extra. We make you do labs. We got to draw your labs. We want to make sure you're a candidate for it. We see people in here on a weekly basis. We can send you home with the injections for 2, possibly 3 weeks after we've seen how you tolerate it, after we teach you about it. We pre-draw up your injections at home. We teach you, we still check in with you, but the patients that are joining our program, they want to come in. They're like, no, I want to be medically supervised. I like the check-ins because when you come in, we're doing an appointment, we weigh you, we talk about, hey, what were you eating this week? How did you feel? Did you have any of these side effects? You noticing any changes in your face, in your hair? We're talking about how much hydration did you have? And this helps hold them accountable. And they say they really like that. And so, yeah, but our patients, I'm not about just giving you a shot and like having you go eat donuts. Like that's not it. No, because that's not going to be sustainable. So we're really helping to coach people so they can make lifestyle changes and modifications. And so then they're able to get off of it. Or if they want to stay on it, they're doing it at super low dose and they might be doing it once or twice a month, maybe. But yeah, that's in our program. Sorry. Okay, how do my cheeks to next to my mouth to get more snatch? How do I get my cheeks next to my mouth to get more snatch? So maybe you feel like this part is heavy. So I don't know if that's, I'm trying to understand. If it's this, maybe if this is heavy, that could look like, that's pretty normal. Oh, sheesh, I don't want that to happen. So if this is low, what we're going to do is do some filler laterally. And then if this is low, and see how my jawline looks kind of like down, what I'll do is some filler here, maybe into the chin to like camouflage this. Other things I'll do to camouflage this jowl. Gosh, dang, that does not look like that. But if this, I don't even want to pull it down. I'm like, no, I don't want to support that pulling. If this is hanging low, this jowl, I can also do Botox into the neck muscle to kind of tighten the jowl, like tighten the neck muscle. And I can do Kybella to dissolve fat there. So Kybella is a permanent fat dissolver. So those are some things, Mickey, but I also want to see your face. You can like text me the pictures. Can I book a consult in the office? Tay, yes. In LA, in National or in Torrance. So yes, you could totally do that. We'd love to see you. It's not low, just puffy. Is it low? And is this low? You said it's not low, it's just puffy. I gotta see you. Maybe it's a lateral thing. Let me see. I gotta just see. Usually it can do some really good stuff. And if it's something I can't do, I'm like, nope, I can't do it. I'll be real. Like maybe that's a surgical consultation. But I'll look and see. You can text me pictures. Does the deposit for the consultation go towards procedure? Yes. So if we do our consult and you come in and get treatment within 3 months, yes, that goes towards your procedure. If we do the consult and you're like, okay, I'm just talking and I might go do this in a year, then that does not go towards the procedure. But most people, when they're consulting, like they're pretty much ready to come in. We just going through everything. Yeah, text a photo. Send me one like this. Send me one like this, like this. Let me see all the different angles, and I'll check them when I get off of here. Text it to the number. Okay. Let me make sure I didn't miss any others, and then I can. So Kay says she's in Vegas. I need to get rid of smile lines. I literally just text her office. You don't need to get rid of them. You're gonna smile. Well, you can soften them. We can make them not so deep. We can definitely make them not so deep. Smile lines, usually the deepest part is gonna be right here by the nose. So as we get older, this part, we lose bone right here. So our nose will start to look a little bit wider. This part of the line looks a little deeper. A lot of times, if I start like working in this whole line will look less apparent. Without like overfilling the line and having it too much. Nisha, hey, I posted a video the other day. I reposted a video the other day. She said, the best injector in California. I hope you're so great. You're so beautiful. And yes, love you. Thank you for coming on here. I just reposted one of our old ones because this is making me laugh. One of our team, I think Samantha. So our clinic page, guys, is under JASI, JASI. JASI Skin and Wellness. And so you should also follow that one. I just have this page because I've been on here talking about Botox for the past 5 years. every day making videos, and but it's really like shout out to my patients for letting us show their before and afters. And I say shout out to them because if it weren't for me being able to show their before and afters, like, thank you guys. Because if I wasn't, and you just saw her walking down the street, you wouldn't think this girl's done anything. You're just gonna think she looks good. Great. But like now, because she lets us show, somebody else that may feel like they have their chin sitting back can see, oh, that's what it looks like after. Or, you know, if you didn't see, definitely, you just wouldn't think. If I say, I'm always like, look at the afters only, you wouldn't think they've done stuff. Like, that's the whole point. Like, they just look like they're born that way. Like, you wouldn't think she's done under eye filler. But like, you see the before, you're like, oh, wow, yeah, she doesn't look so tired. So you wouldn't think she's done chin filler. Like, that's the whole point. You just think like this girl's hot. Like, that's the point. It's gonna look like you. And like, but it's shout out to my patients for all these years for allowing me and my team to share their before and afters. Not everybody does, but a lot of the patients do, because they're like, hey, I found it on your page from somebody else sharing. And so I highly appreciate them for sharing. Remember when my photos fell here earlier, I've been on here talking for a while, but like, again, like if you just saw her walking down the street, she doesn't look like she's got filler full in her face. She doesn't look like she got filler full in her face. We have filled in Botox every part of the face. Like, but that's the point. Like, it's gonna look like you, and it's gonna look fresh. It's not gonna look like you've done stuff. So yeah, but if it weren't for them allowing us to share, you're just gonna think, wow, all these people walking around looking freaking hot. No, dude, we're doing stuff to their face. Even me, that's why I try to show my photos. People are like, oh, you're so beautiful, you don't need anything. I'm like, dude, I don't need anything because I've been doing stuff for the past 10 years. Like, look at the pictures when I was 28 and had that baby and breastfed, and he sucked the life out of me. Like, I look so, I'm going to say haggard. Like, I'm not trying to talk sad about myself, God forgive me, but like, I was so hollow, and I just felt, I was like, why do I look like this? Like, this is not even my face. Like, I just felt really aged. And so people, they want to look fresh. Like, who doesn't want to show up and look and feel their best self? Like, and I've heard from patients over the years, they're like, Ginille, it just made me feel more confident. I felt more confident to ask for a raise. And I'm like, no, you didn't. And they're like, yeah, I did. I felt, Ginille, after we left, I felt more confident. I was able to ask this girl out, ask this boy asked me out, all these things. I was able to leave my dude that was not treating me right. I've heard so many stories like that. And so it's really like, it's a personal reason why people choose to do these treatments. I will talk to you about like, what's going on? I just want to know about your life. What are you getting ready for? But like, nobody's judging you. And if they are, who cares? Like, you still showing up looking your freshest self, and you're like, whatever, if you want to look like that, I don't like it's nobody's thinking about you or the other person. Like, everybody just do the thing that's going to make them feel their best self. So, okay. Was there special certification to become a cosmetic nurse? I have a board certification for like cosmetic nursing. However, it's not required. I did that. Yeah. But really what is required is somebody that's just going to take the time and do it right and study it and study it and study it and practice and go to the trainings. And yeah, but there's no special, I mean, there's like one, but it's not required. And it's not required. Of course I did it because I'm extra. Like, why? Just extra. I heard that occupation back in the day. If I heard that, I would have signed up right away. So yeah, am I promoting surgery bubbles? No, these are all non-surgical things. Every one of those patients that I was showing are all done without surgery. So yeah, everybody here has done treatments, but no surgical things. So we can do, you know, she did some chin filler, she did some under eye filler, some chin filler at the top, lip filler, under eye filler, cheek filler, all the fillers, all the Botoxes, under eyes, like we've done all the faces. Yes, so I've been in this since 2013, so almost 13 years. And when I first started, somebody offered me this job. I was like, I don't want that. Like, I don't even know what that means. I was like, were those people look crazy on TV with those lips? I was like, I don't want that. And then I went and just to shadow, and I was like, oh, it's like regular people. I didn't know like regular people were doing these treatments. Like they didn't look weird, and they weren't celebrities, and they look normal and nice. And I was like, oh, okay. And then I liked the whole, I really like connecting with the patients, and I really like hearing from them why they're doing it. I really love seeing their afters and how they just feel good. And so I just took the job. And then anything I do, guys, I have to be so extra and like try to be the very freaking best that I can ever be. And so I just kept studying it and dedicating and practicing and like being like, why do we consider that person beautiful? Like, we look at that face, why is she beautiful? What is it? What is it? What is it? And I kept having to understand, okay, what's the aging process? What's going on? Okay, how can I inject so they look normal and not weird? Because people are walking around here looking weird, and I don't want people looking weird. Okay, I have some before and after photos flipping through these, so as I see some, I'll show you. Okay, how long does PRP fillers last? So remember, the whole intent with the PRP all natural filler is to make new collagen. New collagen, it can take up to 6 months to see the full effect. The effects, once you get new collagen, it can last for years. Collagen is the most abundant protein we have in our bodies. It helps things look youthful and bouncy and full. We are losing this rapidly as we age, as we get in the 20s, 25. So we want to be restoring new collagen, or else things are going to look saggy, not lifted, not bouncy. So it can last for years. That initial sort of lift you can see is about 3 months. But as that initial lift is going down, I'm gonna show you some photos in a minute, you're getting new collagen in the areas. So she did some chin filler. This one I'll see. This is some chin and jawline filler. These are just photos that of the patients over the years, and we kind of have them showing. She did some jawline filler, some chin filler. So again, we see all skin types, all skin tones, all ages. This is what I do. If you got a face, I can treat a face. Boys do it. He did his nose to make his nose look turned up. He made his jawline and his chin a little bit more defined. He's like a model. She did a little bit of lip and chin. And I think her chin was actually shorter, but this is like not, this was over sessions. So I do things over sessions, guys. And she did a little jawline, but this is not her initial photo. We got a lot of photos. I'm like, I got hundreds, but it's to the patients. Thank you, patients, for being lovely and sharing and helping other people see what this can look like. Nose filler, I forgot to talk about noses. It just says that, sunscreen. Yeah, it says wear your sunscreen. Noses, camouflage a bump, lift the tip of the nose, make a highlight so it can look a little bit thinner, minimize asymmetries. The nostrils, sometimes people are like, oh, I want my nostril to not be triangle. I want it to be round. I hear all the requests. And if it's something I think I can do, I will tell you and help you to do it. If it's not, I'll be like, that's not gonna work. Oh, this is a scalp facial. Okay, so that one went fast. Under eye and Botox, just to help eyes look. He did chin filler, jawline filler to give more more square. So it just depends on like what the person wants. But again, we see all the faces, little lip filler in her. Okay, let me make sure I didn't miss any things. Patients with deep smile lines. Okay, I gotta find them. I got them. They're just coming, and they're just flipping through. I don't have them like exactly pulled up, so I gotta pull them. Deep smile lines, yes, we have them. I got them. We got all of them, and it's not just smile lines. It's really not just the line. It's the face. So remember, it's not just here. I might be treating this, so it's like the face. We can pull some and show you. Yeah, those are just more patients going. Okay, if you have other questions, okay, you're funny. If you have other questions, please let me know. I was just in Vegas Monday, and that was earlier this week. I go there like once or twice a month, but we have a whole team there, and they're amazing. And one of the Vegas injectors just texted me. She was on the JASI page going live. So you guys, again, I was also saying you should follow JASI, J-A-S-I, Skin and Wellness. That is my clinic. That's the clinics. But if you want to see the other providers, you'll see them in the office, and they're lovely. Again, I would not put you on to people or anything. Anything I say is going to be from my heart, and I ask God to guide everything I do in my mind and my words and my actions. So it's like, these girls are great, is what I'm trying to say. What can you do for a double chin? You can camouflage it. If your chin sits back, you can do filler into your chin to elongate it. You can permanently dissolve it with Kybella. Kybella is a injectable medication that breaks down fat cells. Takes a lot of vials, a lot of sessions. If I see the photo, I have some photos. I'll show you of people that have done it. Or you can do like surgery, liposuction. So those are some things for. Oh, and then you can also do Botox under here. I was saying that earlier, like Botox into this neck muscle. People will feel like, oh, when you did Botox there, it made my double chin not disappear, but they're like, it just looked tighter. Like it didn't show as much. Any black injectors in Vegas? Yes. And Samantha was just texting me when she was on here. She's like, I went live. I wish I would have seen her on here because I could have like joined with her. We should have coordinated that better. But I was just like, I'm going to go on live real quick in between patients. But yes, she's there. And again, everybody I see, even if you come see Claire is white. She's a big creator on here. She got a bunch of followers. Claire treats all the people. Like any person in my office treats all the people. Like there's nobody that like, it's just what we do. It's just what we do. We treat faces and we do it excellent. But yes, Samantha's there and she's back. She's Black and she's awesome. Interested in becoming an aesthetic nurse after school. Already have my ADN and aesthetics license. Go ahead, girl. Any advice on landing a job? Be about it and just keep going. I have somebody in that similar position right now, and she kept messaging me. And I was like, girl, gosh, if you keep messaging me, I'm like, stop. Okay, just come into the office. And then she came and I really liked her. And then I was like, okay, you can shadow. You can like keep shadowing. And then I was like, okay, I really like you and the patients like you. Okay, you want to work here. So yeah, I would just say be persistent. I would say show them what you can do. You know, if you're already coming in there because you're an esthetician, you understand skin, talk about what you understand. I think be nice. That's a big thing. Yeah. What have I done to my face? It is so perfect. You are so kind. And I don't have my before and afters on me, but maybe I can try to pull them up on this phone. I have done a lot of things to my face, and I will show you the photos of me over the time. I've done temple filler, and all the spots I've done filler, I've also done natural filler. So if I say filler, I've done both. I've only done natural filler the past 2 years because I was breastfeeding this baby, still breastfeeding this big baby, and I was pregnant. So I haven't had regular filler, even though I love filler. I haven't had regular filler in 3 years. But temple filler and regular filler. Under eye filler, that was like the first thing I did. And natural filler. Cheek filler and natural filler. Smile line, natural filler. Chin, a lot of chin. My chin was really back. And natural filler. And let me see if I can try to like show my image, if I can pull it up on the phone. Let's see, I don't know if I'll be able to do it. But I've done those. I've Botoxed my whole face, my frown, my forehead lines. I don't even know if you guys can see me because I'm trying to pull up this photo, but I don't think I'm gonna, oh, maybe if I keep scrolling. I've done Botox my whole face. Here's one. Here's one of many that I show online. But I've done Botox everywhere. I have dissolved fat underneath my chin. I've Botoxed my neck, my frown lines, my forehead lines, around my eyes, my chin for dimpling, my nose, little smile lines. What else have I done? Oh, all the skin treatments, obviously. I do those on a monthly basis. Microneedling, laser, Aerolase laser, bio repill and hydrofacial. Those bio repill is my favorite right now. I'm probably gonna do it today. But yeah, like this was me when I was 28 on the side where I look so tired, guys. And I'm now 38. So I've done all the things and I have 3 kids and I'm breastfeeding a baby all dang night. Like I don't look so haggard as I felt like I did in this one when I lost a lot of volume. But I've done a lot of treatments and collagen stimulators over the years. I will say skin is like probably my favorite thing. I think everybody, like if your skin looks nice, that looks great. 11's on my forehead. For those ones, Botox. If they're really deep, you can do filler or the natural filler. Thank you. 38 looks good. Oh, I appreciate you. I am tired too. I just don't want to look like I'm tired. I am so tired. I don't want to be looking beat up, especially going to be out here doing this as my job. I'm happy with my face in the mirror, but I'm so asymmetrical in pictures. Is this normal? Yes. Normal. I tell people don't try to chase perfect symmetry. We're all going to have, I've done it. I tried to chase asymmetry when I was younger and like it was dumb. Like I end up just looking weird trying to like do too much. But we're gonna have asymmetries because we sleep more on a side, we get more sun on a side, we chew more on a side, we may talk more on one side, like we animate more on one side. So it's normal. You're never gonna be perfectly symmetric, but we can minimize asymmetries with some of these treatments. But yeah, I also think some of the asymmetries like make people look nice. And before I make somebody like, if I see somebody like when they talk and they like, some people like, they raise their brow a lot. And before I'm like, oh, if I'm just make this equal, I ask them like, do you like that? Is that your thing? Cause like, think about The Rock. He's like, I'll smell when I'm cooking and all that. Like if you took his brow arch away, he wouldn't like that. So I ask people, do you like that? Or do you want to be like, sometimes they're like, oh, I didn't know I did that. Or no, I don't like that. So that's why we consult. That's why we talk. That's why we got to be thoughtful about your injections when you're doing it. Under eye bags, if it is hollowness, sunkenness, you can do filler or natural filler. If it is just a bag that doesn't have any sunkenness beneath it, oh, she has one. Let me show you. Wait, don't change photo. She has under eye bags. So that's her before and that's her after. You can't get rid of the bag, but unless you do surgery, but you can camouflage it. Her too, she did a little bit. So I just saw it pop up outside of my eye. So you can't get rid of it. You can camouflage it with filler or the natural filler. If you want it gone, surgery is to take it away. Oh yeah, this lady has one too. I'm seeing some of those photos out of the side of my eye. So she has under eye bag here. It looks like I took it away. I just hid it by bringing that skin underneath. I lifted that skin underneath up. Mine is like how mine was. Girl, sunken. Fat was sucked out of my face by that big baby. He'll be 11 in a few weeks. Yeah, sucked all the fat. I'm 5'9", and I mean a thinner frame, not like, I don't know, a thinner frame. But yeah, when I lose fat, I feel sunken here. So think about like a skeleton. That's a good way for you guys to think about facial aging. All those spots on the skeleton, on the head, the circle spot, that's where the fat is sinking in. Circle spot here, right here. This part gets deeper. And people don't think about it. They just want to put cheek filler because they think if they put filler here and their dang injectors tell them, oh yeah, if you put filler here, it's going to lift. I'm like, it's not like that. No, you gotta, it's not going to lift like that. It can create a little bit of a highlight. You don't want to build your cheeks up too much and have this big and then sunken above and below. So you want to be mindful about it. Do you do consults online to help guide nurses or teams in another city? No, but if somebody texts me and they're like, hey, I need help with this, I'll text them back and tell them what to do. Or tell them my thoughts and my opinions. If you need help, definitely, especially, yeah, I will definitely help anybody. Do you see more of us like the mirror? Do people see us more like the mirror or the back camera? I don't know. I just look at what's in front of me. I don't really know. I actually don't use a ton of back camera unless I have my girl helping me film videos and she filmed it from the back. But okay, natural filler. Draw blood from your arm, spin it in the centrifuge, separate out your growth factors, your stem cells. We heat it. It makes a gel, and we can inject that any part of the face. Wherever we inject it, it's going to make new collagen over time. New collagen will help things look lifted, help things look revolumized, let things look more youthful and bouncy. I really like that. And you can do the natural filler all over your face. That's the one I've been doing, I said, for the past couple of years since I'm breastfeeding that baby. So in all the spots I've done filler is where I've also done the natural filler. Like these things, also the stuff I do, guys, most of the stuff you probably wouldn't even know on, like if I were to look at when I'm injecting people's faces, it's in these places that you're not going to think about. So for me, I would probably hit up like this little shadow and this shadow. And you're going to think, Ginille, shut up. There's nothing there. I know. But when it's straight, there's really nothing there. And then the way light hits off the face. I know how to make light hit off the face so it looks natural. It doesn't look puffy and overdone. Like that's a big thing for me. I don't want it to look overdone. So it's like sometimes these little areas that not all the injectors know. Like, I think injectors know smile lines and cheeks. And I'm like, that's cool. And lips. I'm like, there are other parts of the face that are aging. And if you are not hitting up the temples, and if you're not hitting up this spot here and the chin where it sits back, and you're missing these shadows, it's gonna still look off. Like we gotta be comprehensive when we're thinking about your face and the facial aging. Now, you don't have to treat them all, but I'll talk to you. I will say, hey, this is what's happening underneath your skin that you may not know right now. If this doesn't bother you, ignore what I'm saying. Anything I ever say is never to hurt your feelings. That is not. I don't want people feeling self-conscious about stuff. I'm not here to pick apart your face. That is not it. I'm like, that's not ever my intent. I'm telling you these things from like what's going on from, I study this this is my work. And I will tell you all day, like, yo, you don't need it. No, don't do it. Like, don't, like, you don't need it. None of us need it. Like, I don't need it in this picture, but did I want it? Yeah, I did. Did I feel more confident like that and like this? Yeah, I do. But, I didn't need it. I'd be perfectly fine living life. I'm smiling. I'm happy. I'm good. I mean, I felt tired. I was tired. I just didn't want to look like it. So, no, you don't need it. You're fresh without it. Shine God's love and light without Botox and filler. Like, you're good. I tell people all the time, like, you don't need it. However, this is what's happening. If you're seeing this and it bothers you, here's how we can approach it. If this doesn't bother you, ignore what I'm saying right now. or maybe keep it in the back of your mind, because these are the areas that are going to keep aging, and people don't think about it. They just think, I see this line. I'm like, it's not just this line. Like, where are we losing volume? Like, even for under eyes, I think a lot of people will do the under eye filler right here, and then they skip all this back part. And I'm like, dude, there's more part to their under eye. Like, this is a whole circle here. Like, we got to treat the whole thing. You know, they don't really train like this when they're training injectors. So I've just treated a lot of faces, and I've treated a lot of diverse faces. I've treated all the faces, period. It's just like what was really important to me. Yeah, so it's something. Okay, so I keep going on. Mickey, can you dissolve natural filler? No, because this one is made from you. Your body's going to reabsorb it. Okay. Make sure. I'm an RN. Is extra schooling required to be an aesthetic nurse? Currently certified to do Botox and filler? No extra school is required. However, you're going to be taking a lot of trainings, especially in the beginning. Get skilled on Botox. Get skilled on skin treatments. Those are treatments that are, people are coming in and looking for. The filler, you just want to be more mindful, because these things last longer in the skin and higher risk for complication. Study faces. Study how the face ages and where those fat pads are separating. Look at different types of faces. Look at people's before and afters. And when you start doing faces, look at their before and afters. Look at all these freaking photos I have put together over the years, guys. And we still have to do like hundreds, if not thousands of photos more of patients that have consented. It takes a long time to like go through their photos. I mean, some of these people, I've done them over years. I got, let me pull back to 2020, 13 and 20, and find that photo. And is the lighting right in this? Is her angle right? If it's not, I don't want to show like an angle and lighting difference. I want to show people like real before and afters. But what I would do when I was younger is I finished the treatment. I would go home and I'd study the photo and be like, what could I have done better? Like, what should I do next time? Or what is missing? So trying to constantly critique. I ask the patients, tell me what your friends are saying and your family is saying. Does anybody know? Because I don't want them to know. Like, they need to be saying, they're like, oh, they said I look fresh. I got carded. They said I go on vacation. I'm like, great. I don't want them to say, they said, who did your lips? If they said that, I'm like, dang. That means my work was detectable. I want it to be not where nobody knows. It just looks fresh. Study it. Ask them for feedback. You see, I be yapping. I talk to my patients a lot. Help me to be better. What are you seeing? What really made me good, I think, is I'm in LA, working with people in Hollywood and on camera and on screen. Because they would be saying stuff to me. I see them in person. I'm like, you look great. What are you talking about? Shut up. And they're like, no, but when I film or whenever they're editing my videos and and they always have to do this out, or they have to retake this and look at me. And so then I started studying my patients on camera and on screen and in the movies and all that, and being like, oh yeah, the light does, like, yeah, she's right. When she turns that way, that looks kind of harsh, and she does look. And so I started really understanding the face from all the angles, not just this angle, guys. The world sees us here and here and here and here and here and here and here. And then I started like all of those things. So it's just a lot of studying and like being meticulous, and I pray all day. And yeah, like if I don't think I can do something, I will be realistic. If it's something I'm like, I think we can do, let's try it. And then understanding the products, there's a bunch of product lines out. How does this work? And what faces is it actually going to make a difference in? Because my face and then the face of a 70-year-old white woman are different faces. We got different fat in our face and different. So like, how does that product work? They're only showing me before and afters of like white women that are 50 plus. Like, is that going to translate to somebody that's not in that demographic? So those things. My fear as an actor is that I won't be able to express myself fully. What do you do with actors? Actors, they do a lot of the natural filler or collagen stimulators, light on their Botox. So Botox, you can do it to where you're frozen. I got some people that want to be frozen. I got some people that still want to have lines. So that's all, like, it should not just be like, everybody gets 20 units. Like, the units change. Like, everybody's is different, and it could even change in the person. Like, just because we did it this time one time, you might be an actor and this time be like, oh, my role is to be tired and sad and haggard, but I don't want to be that haggard because I don't want to look so crazy, so we go light. And the next time you might be like, I'm a sex worker and I need to look a little luscious and whatever, and so then we might change it up, your dosing. So that's why we're always talking. Even these people I've seen for all my career, when they come in, we're still talking about what should we adjust? What's going on in life? What are you getting ready for? Okay, how long are you going to be gone? All these things, because that plays a role in the treatment that we do that day. But yeah, we typically don't do like super strong on their Botox so they can still emote. Skin treatments for actors all day long. Have your skin nice, because they are getting makeup and stuff and wearing the makeup all day and it's in the sun and all that. I think, and you just don't want your skin looking weathered. Who wants their skin looking weathered? Not me. So anyway, how long does Botox and filler last? Botox, 3 to 4 months is like about average. However, that number greatly varies depending on how much we do. The actors, I might be seeing them back in 2 months because they go so light on their dose. They wear through it faster. I got some girls, freeze me up, Ginille. I'm coming once or twice a year, frozen. Oh, okay. So then we're doing like double the dose. Even on myself, I've done it before. Triple, not even just double. I did 100 units in my frown. I did 50 in my forehead, 25 on each eye. It lasted me a year. I don't tell people that, but I tell them I don't like go on try to promote that, but yeah, it lasted a year. They've since done studies. What they will say, they say most Botox lasts 3 to 4 months. They're basing it off of Botox, 20 units in your frown, 20 in your forehead, 12 on each eye. For the general population with moderate to severe wrinkles in those areas, it lasts 3 to 4 months at that dose, 64 units. They have since done studies where they say, oh, if you do 60 units in the frown with people with moderate to severe lines, we have found for that population, it lasts 6 months. So the more you do, the longer it lasts, but the more frozen it is. So for this actress, it says, if she's like, I want it to last super long, but I don't want it to be frozen, that's not really gonna work. Because, yeah. Okay, let me see if there's other ones. Yes, Foxy, got you. Can you? No. Okay, if you have other questions, please let me know. So 3 offices, 2 in Los Angeles, Mar Vista, Torrance, 1 in Las Vegas on the Summerlin side. Got a whole team of providers that are excellent. They see these patients too. We work on skin health, hair health. Oh, I'm gonna check on. I'm going to just check some text from my team. Okay, if you think of anything, call us, text us. The number in the link, if you in the profile, I see all of them that go through. My team sees them. They're texting me like, you talking to this person on live? They're asking me questions right now. So do that. They're very, they're responsive. Everybody on the team is extra, guys. We're just so extra. But they're responsive. They'll get your things. You can call us. You can send us pictures. I'll look at them. Set up your consult there. And if you think, what location am I at? I am at all the locations. They're all my clinics. I'm at all the locations. I see patients in all of them. So yeah, it just, yeah. Some people, I go to all of them. I'm in Torrance today. Seeing a few patients and then mostly working on my videos and admin stuff for the clinic. But yeah, I go to all of them. If you think of anything, please let me know. Call or text us. God bless you guys. Thank you for tuning in. I'm just going to check on my team. I hope you guys have a great day. Bye.